Thank you very much, and welcome to this again to this Indo-Russian webinar. Starting from where my previous speaker left, that is the lasers in refractive surgery. I'll be now talking about the femtolaser assisted cataract surgery, as to how the femtolaser assisted cataract surgery is revolutionizing cataract surgery. I'll be showing you some basics, and then I'll be showing you some examples where the femtolaser cataract surgery is helping us in pushing the limits as regards various difficult procedures. Now, femto, as things stand today, is a tool for the routine as also challenging. More often than not, the comparison is made only to the routine cataract surgeries as to how much it improves the normal phaco procedure. But I think the examples that one needs to look at is that when you push the limit and you are able to simplify the difficult by using the femtolaser technology. Now, if you are looking at the femtolaser technology, there are certain things which are happening, and that is we have to look at the demographics and the demands. So when we look at the demographics, the younger than the average cataract patients are also demanding a glass-free, spectacle-free, spectacle-independent kind of a vision. And I think the days are not far that we will have great intraocular lenses where even presbyopia would be treated by doing a clear lens exchange. The lifestyle changes that are happening, the patients are ready and willing to pay the premium. But the important thing is that they're looking at the holy grail of spectacle independence. So therefore, what you need to have is the highest rate of post-operative satisfaction which is there. Now, when you look at any cataract surgery versus a laser vision correction, which was talked about by my earlier speaker, the exactness of the outcome is much, much better as regards the laser vision correction. But the cataract surgery, the patients who are reaching emetropia, target emetropia, are much lower than what you get in laser vision correction. So therefore, there is a scope for improving the repeatability of a procedure in everybody's hand. So you need to have a repeatable procedure in everybody's hand, which can be repeated in all types of cataracts which is there. So femto cataract is something that is making the cataract surgery into a refractive procedure. Now, when you're looking at a refractive procedure, what you want, as I told you, is predictability. And the first thing that a femto laser does is to give you an excellent size, shape, and position, and a more predictable effective lens position by doing an excellent capsulorhexis. The second thing that the femtolaser does is that it does the lens fragmentation, and therefore it has been shown that if you have harder cataracts, the amount of energy that is being used for phacoemulsification is greatly reduced, much lower than 50% of what it is. Apart from that, the third thing that it does is to give you the incisions, which can be multiplanar incisions, and giving you better stability. And the fourth thing that it does is that if you are not wanting to do a lens-based toric IOLs and you have a smaller degree of astigmatism, that can be corrected by doing the arcuate incisions with the femto. Now, let us just see that apart from the usual situations where we are looking at, I am now talking about pushing the limit and looking at various difficult situations. So let's look at the posterior polar cataract. Now, all of us know that 30 to 40% of posterior polar cataracts have a pre-existing capsular rent, and therefore it can cause you a problem as regards the outcome of having a drop of the nucleus or having a vitreous coming out and causing problems in the cataract surgery. Now, when you have a pre-existing weakness in the posterior capsule, the hydrodissection, if you do in a normal phacoemulsification, can cause a hydraulic rupture of the posterior capsule. Now, what happens in a femto laser is that you don't actually do a hydrodissection, but there is a pre-existing pneumodelineation that happens, not a dissection, but a pneumodelineation that happens once you have passed the laser. So therefore, this would eliminate the need of doing any hydrodissection or hydrodelineation. So you really don't have to push in a gush of fluid to actually get the dissection or delineation of the various layers. Now, the femto laser enhances the nuclear disassembly. That means that the nucleus has been broken into small pieces. You can have concentric rings or segments, and this will simplify the nuclear removal that is there. Our recent publication, which is there in the Journal of Cataract and Refractive Surgery, has shown that the integrated anterior segment OCT can detect pre-existing posterior capsular rent dehiscence, and it will increase the safety of posterior polar cataracts. And ever since we have been using this, the incidence of nuclear drops has gone down very significantly. Now let us just see that how does this imaging help a person in posterior polar cataract. You can see this is the catalyst system we are docking. Once we have docked, you can see that we will get the OCT image. Now look at this is the anterior cornea, the posterior cornea, the lens surface, and you can see that there is a defect which is very clearly seen. So there is no posterior capsule here. So we have increased the default setting so that the pneumodissection does not cause any dehiscence of the underlying area. And you can see that it is only at the extreme end. Once we have the disassembly, I ran it at double the speed, don't worry. So you can see that there is a defect that came, and a 3-piece lens one was able to insert without much problem. So the femto advantage in posterior polar cataract is that the delineation enhances the safety. So you can have the epinuclear cushion which will be there. The softening of the nucleus helps tackle the harder grades, and there is a perfect CCC that you have for circle implantation. So this epinuclear cushion will remain right at the end when you are removing the epinucleus, but till such time you will get an excellent taking away of the entire nucleus without any problem, because that has been disassembled earlier by the femto. Now, thank you very much, Professor Boris, for introducing this Malugin ring, which is a fantastic device for the dilatation of the pupil. And femtosecond laser-assisted cataract surgery can be done even in small pupils after the placement of Malugin rings. So let us just see that how one can do. In this particular case, you can see it's a small pupil which is there, as also the patient has iris atrophy which is here. So you can use this Malugin ring, and once you have this Malugin ring in position, you can go back to the femto laser and you can really go ahead and do the femto assisted procedure. So you can see this is the ring that is there. You have the iris away, and you can do a good capsulotomy that you have, and a good nucleus fractionation. So even small pupils are now not difficult to handle with the femto laser. So if you push the limit, you can have the Malugin ring stay in while you are doing a capsulotomy and nucleotomy, and then go back and again complete the phacoemulsification procedure. Another important thing is that when you are looking at phacomorphic glaucomas, or you have a swollen up nucleus, the biggest problem that you have is the Argentinian flag sign. Now you can see here a swollen phacomorphic glaucoma. You can see that the iris is very near to the back of the cornea. He's a doctor who came to us, and you can see the swollen clefts. But just watch here that when you did the capsulotomy, there was a huge amount of fluid that came out. But since we are working on a closed chamber, you can see that we will get a complete capsulorhexis. So you can see that this is a complete capsulorhexis that you get, and then you can go ahead with the procedure and complete the procedure. So the biggest challenge that you have in the hypermature swollen cataracts is that you can have a runoff of the capsulorhexis, but when you are working on a closed chamber with femto, you don't have that. Now let us see that if we push the limit in rock hard cataracts, this has been shown that if the cataract is not white, and if there is transparency in the nucleus, then under those circumstances, the femto is able to penetrate the nucleus. And you can see here, this is a capsulotomy, and we were debating whether to do an SICS or not, but then I went ahead with the femto, and you can see here, can you see the air bubbles that are coming? And you can see that this is a black cataract which is there, but you can see that the sectioning that has been done by the femto is pretty good. And now Dr. Chi has shown that it is actually increasing the energy, and you need not do repetitions, that you will still get a good cleavage plane. So you can watch here again that we were able to get a good outcome. So all that I'm trying to say is that in brown cataracts and in black cataracts, the femto actually increases the ease of breaking up the nucleus. Now, since we are on the celebration of Dr. Fedorov's birthday, and RK was something that he gave to the world, it was earlier considered that patients who had RK done earlier and there were the corneal scars which were there, this would be causing a problem as regards the femto procedure. But what we have to just be aware is that it is only if you have thick scars that you could have a problem of less penetration of the energy. So what is important is that you do not do the incisions if you don't have a clear area. But the capsulotomy, you just have to increase the energy. But what is also important is that you need to use trypan blue so that you are taking care of any tags which may be there. The disassembly will happen as you want, and that is something which will make the nucleus removal easy. So you can see here multiple cuts, RK. You can see a flat cornea in the center. You can see the knee effect, and you can see that we are increase the energy. We are doing the softening of the nucleus, and all that we have to do is that below these incisions you could have a problem, and you are to use trypan blue. And once you have used trypan blue, you can see that under these circumstances the entire capsule comes out pretty well, and the phacoemulsification of a pre-chopped nucleus is almost like an aspiration that you are doing. So you can see multiple RK incisions in this particular patient, and you can easily go ahead and do a femto procedure. So friends, it is not a contraindication for doing femto procedure. You just have to be a little careful that there may be some areas of skip which could be there. You can also do femto laser in cases of vitrectomized eye, and what is important is that the anterior capsular fibrosis which could be there can be actually tackled very well with the femto laser. The only important thing is that if there is an emulsification of the oil, silicone oil, if it comes into the anterior chamber when the patient is lying down, that will be an area where the femto will not penetrate. So it is better to avoid doing a femto procedure in cases if you have an emulsified oil and that is coming on into the anterior chamber. Now, let us look at a post-traumatic subluxation. This is the post-traumatic subluxation. The importance of femto in this is that you can place the capsulotomy the way you want. You can see here, this is the iris and this is the subluxation. And if you look here, there is some amount of vitreous that is coming out. So you can see a little bit of blob of vitreous. So therefore, the femto will give you the advantage despite a subluxation that the capsulotomy will come fantastic. So you can see there is a capsulotomy that has come very well, and we are just removing any vitreous which is there. We have gone in posteriorly and injected tricot, and I am removing all the amount of vitreous that was causing a decentration of the lens. So once you have this, we are putting in an endocapsular ring. So what I have now is a great capsulotomy. I have a pre-chopped nucleus, and I have been able to actually take away the stress from the capsule despite having a subluxation. So you can see here in this particular case, this is the irrigation aspiration that is being done, and we are able to complete the femto procedure very well. So friends, in such cases of subluxation, you can actually center. You can see that the capsulotomy is pretty well centered, and a three-piece lens is being injected to actually give more support apart from the endocapsular ring in this particular case. So this is what I wanted to show you, that femto, if you push the limits, it is actually a new paradigm in cataract surgery, and you get great outcomes in these difficult cases. And this is the post-op picture of the same patient, who was again a medico in this particular case, who came to me from the state of Bihar, and the outcomes have been pretty good in this particular case. So to sum up, I would say as the technology of femto laser-assisted cataract surgery evolves, it finds widespread use not only in the simple cases, but also in complex cases. And friends, I would say it's the time to take the leap of faith and switch over to the femto, to the power of femto, to get excellent outcomes for your patients. Thank you very much for your kind attention.